who wouldn't want beautiful hair, skin, and nails? And with that desire, the beauty and cosmetic industry goes to great lengths to market products that claim they can give what we want. Ask just about anyone what they need to take for better looking hair, and they'll probably mention Biotin somewhere on that list. What's the information that's being passed around about Biotin that makes people think it's some kind of a silver bullet? Hi, I'm Dr. Sharon, clinical dermatologist, and this video is about Biotin supplements and what you need to know if you're currently on them or are planning to take them in case of hair problems. So stay tuned for that. Biotin is one of the many numbered members of the B-complex family of vitamins, B7 specifically. Now, the discovery of this vitamin goes back to the early 1900s when researchers found that feeding raw egg whites to rats caused them to suffer from skin rashes, alopecia, and various neurological deficits. And upon further research, they found that a certain protective substance found in organ meats and other foods protected them from this egg white toxicity, and this substance came to be known as biotin. Now, it's also known as vitamin H, where the H stands for German words Authenda, meaning skin and hair, and this term was coined by Hungarian scientist Paul George in 1930s. The main function of biotin is actually not to do with skin, hair, and nails, but it's related to the metabolism of macronutrients like carbohydrates, proteins, fats, thus impacting brain health and general function. Now, it's also required for keratin synthesis, particularly of the hair and nails, and that explains its connection to them. Now, what are some sources of biotin? Organ meats like liver, cooked eggs, salmon, nuts, legumes like peanuts and soybean, tomatoes, sweet potato. Now, if you're on a balanced diet, you really don't have to worry about a deficiency. It's actually rare to suffer from it if you're otherwise healthy. Now, a true biotin deficiency can be seen in case of genetic and inherited conditions, the most common of which is biotinidase deficiency. Now, other situations where such a risk can occur include pregnancy, then chronic alcoholism, gastrointestinal disorders, or post-surgeries where there's malabsorption of nutrients. Then patients who are on IV nutrient infusion for a long time, that's total parenteral nutrition. Then patients who are on anticonvulsants or antibiotics for a long time. Then those who, eat an excessively large amount of raw egg whites. Remember the rats. Now, such patients may present with symptoms of skin rashes, fragile nails, brittle hair, and conjunctivitis, certain neurological problems, and depression. Now, in these situations and in other conditions like brittle nail syndrome or uncombable hair, which is a genetic condition, supplementation may not only be helpful, but it can even be life-saving. What about for relatively healthy individuals who have normal biotin levels but are suffering from, say, hair problems? Do biotin supplements help them? Well, so far research says that there's not sufficient evidence to prove that these supplements are helpful if you don't actually have a deficiency. Now, currently, the adequate intake of biotin for the average adult is 30 micrograms, and this you can get through a normal diet. By taking dietary supplements, which may contain 5,000 micrograms or 10,000 micrograms or more, an individual might be consuming more than 300 times the adequate intake. Excess of biotin hasn't revealed any toxicity so far, and maybe that's why people have a casual attitude towards these supplements. Maybe they will work, maybe they won't. There really is no harm to it, is there? The FDA will beg to differ. So a drawback with these supplements is that these may interfere with certain blood tests, causing falsely low and high results, and this happens because the lab may be using biotin technology in their testing methods. So in 2017, the FDA issued an alert saying that low troponin levels, which is a test that helps detect heart attacks, as a result of biotin supplements caused a patient's death. And this warning was again released in 2019 because of more cases where blood tests were impacted with excess biotin. Now, other tests besides the troponin test, which may be affected by biotin, excess biotin, include thyroid tests and certain pregnancy tests. Besides biotin, these over-the-counter pills may contain other vitamins like vitamin A, vitamin E, then minerals like selenium and zinc. And unlike biotin, excessive amounts of these ingredients can actually be toxic for the body and even cause hair loss, as seen with vitamin A and selenium. And this is counterproductive if you're taking these pills for hair loss in the first place. Now, till date, there is a lack of published studies to determine if these supplements are helpful for better growth of hair and nails in the absence of a biotin deficiency. But still, biotin is one of the most marketed nutrients in the case of hair supplements, and this claim is really a bit too exaggerated. Hair loss, alopecia, thinning of hair is a multifactorial problem, and there are many causes for it. It could be genetic, that is, male or female pattern of baldness, known as androgenetic alopecia. Then it could be because of medical conditions like PCOS, thyroid disorders, lupus. Then nutritional deficiencies like those of iron, zinc, niacin, protein, vitamin D. Then it could be because of gut dysbiosis, which is an imbalance in your gut bacteria, which can occur after long-term use of antibiotics or even after conditions like inflammatory bowel disease. Then after stress and hairstyle practices like wearing tight ponytails. And finally, even age. So if you're suffering from hair loss, my best advice to you is to consult a doctor who can find out the source of the problem and then guide you to appropriate management. Now, it's easy to buy supplements off the internet, but you might just be wasting your money by following these fads. Now, like I always say in these videos, do the research and be aware of what you consume, what you put on your body, and if required, get checked out to find out the root cause of your symptoms. And by doing so, you might save time, money, and cut down on stress, which can actually worsen your hair loss, and we're stuck in a loop. And that's it for this video on Biotin. I hope you enjoyed it and will think twice about ordering that next batch of supplements. Until my next video, bye.